Hello, my name is Christina and I am a pediatric pharmacist here at Orlando Health Arnold Palmer Hospital for Children. I'm going to talk to you today about how to use the epinephrine auto-injector, or EPIPEN. It's important that all members of the family and the patient watch this video to fully understand how to give this medication so that everybody is prepared in an emergency situation. The epinephrine auto-injector should be given right away at the first sign of a severe allergic reaction, which is also known as anaphylaxis. The most common signs of an allergic reaction are swelling of the lips, tongue, or throat, and around the eyes. You could also have hives or itching of the mouth, throat, or skin. You may have trouble swallowing or difficulty breathing that might present as coughing or wheezing, or feeling like you can't quite catch your breath. If you experience these signs or symptoms, especially after exposure to a known allergy trigger, it's important to use the epinephrine auto-injector right away. The medicine in this injector is called epinephrine. It may also be referred to as epi or adrenaline. This medicine works by stopping an allergic reaction in the body. It also works by opening the lungs, increasing blood pressure, and decreasing swelling and reversing the body's allergic response or anaphylaxis. It is incredibly important to use this medicine right away if you think that you are having an allergic reaction. The EpiPen will come in a plastic case, and the pen itself has this blue safety release, orange tip where the needle is located, label with instructions, and a window to see the medicine. You should receive 2 epinephrine auto-injectors when you fill the prescription at the pharmacy. There are 2 different doses for EpiPen, one is green and the other is yellow, and your doctor will order the appropriate dose for you. You will also receive a gray training pin, which I'm using today. This gray training pin does not have any medication and does not have the window to see the solution. Do not carry around the trainer with you, as you could accidentally grab it by mistake in a true emergency. Only use the trainer to teach friends, family, babysitters, and other loved ones how to use the EpiPen. To give the epinephrine auto-injector, first remove the EpiPen from the case and wrap it in the palm of your hand. Do not put your fingers, thumb, or hands near the orange tip of the pen to prevent injecting yourself by mistake. Remove the blue safety cap by pulling straight up, which will allow the needle to activate. If you do not remove the blue cap, the auto-injector will not work. An easy way to remember this is the phrase blue to the sky, orange to the thigh, to remember that the blue safety cap needs to be pulled up and the orange tip where the needle is located will be injected into the thigh. You can inject the pen through clothes if needed, just make sure that the needle will not hit any buckles, zips, buttons, or thick seams through the clothing. Swing and push the pen firmly into the side of the middle of the thigh, straight down until you hear a click, like this. Hold the pen very tight in place on the thigh for 3 full seconds, so make sure you count out loud to 3. 1, 2, 3. Then you can remove the pen from your thigh, and as you can see, the orange tip will be extended to cover the needle. This confirms that the medicine was given. Massage the injection area for 10 seconds and call 911 right away. Even if symptoms go away or there is 100% improvement, you still need to call 911 to be evaluated by medical professionals in case the symptoms worsen or return. If the allergic reaction or anaphylaxis symptoms do not improve or get worse after 5 to 15 minutes, you can give a second EpiPen the exact same way while you wait for the ambulance to arrive. Side effects for this medication include anxiety, tremor or shakiness, weakness, dizziness, sweating, heart palpitations, nausea, vomiting, headache, or respiratory difficulty. While it is very important to be aware of these possible side effects, remember that epinephrine is a life-saving medication, and the benefit that this medication has by stopping an anaphylactic reaction outweighs the risk of any side effects. If you do experience any possible side effects, make sure that you or your parents or guardians tell medical professionals right away. Keep your EpiPen with you at all times for emergency situations. Keep the pen in the carrier tube to protect it from light and store it at room temperature out of reach of young children. Do not refrigerate this medicine or keep it in the car where it might get too hot. Check every few months that the solution is clear and colorless, and replace the pen if the solution is discolored, cloudy, or looks like it contains particles. Make note of the expiration date when you first pick up the medication, and always have one available that is not expired. Since the pen does contain a needle, take the EpiPen with you to the emergency room or give it to the medical professionals that arrive in the ambulance so they can dispose of it for you, and they will know exactly how much medication that you have already received. Like I said before, the epinephrine auto-injector is a life-saving medication that needs to be with you at all times. If you have any questions about what you learned today in this video, please talk to your nurse, and a pharmacist can come discuss any medication or administration specific questions with you and your family. Thank you for watching. Goodbye.